We begin with the scramble for supply and changes coming in the way Floridians will be getting the COVID vaccine.
More than 1 million Floridians have had their first shots. A lot of them are seniors, but more than 4 million seniors in the state are still waiting for theirs, along with all the younger residents. This week, hospitals had to cancel appointments after learning from the state the vaccine supply just wasn't there.
States have been receiving vaccine distributions from the national supply, though with the new Biden administration, those logistics may be changing again. And that is where we start with Florida's Lieutenant Governor Jeanette Nunez, who is with us today from Isla Mirada. Good morning, LT.
Good morning. Good morning, Michael.
Lieutenant Governor, great to see you. Thanks for being with us. The supply of the vaccine, we got 266,000 doses last week. Are we out of vaccine? What's going to happen this week?
So as you aptly pointed out, this is a supply issue. And so we are at the behest of the federal government. So each week we get informed what our allocation will be. As you mentioned last week, 266,000. That is the expectation for next week. We were hoping for an increase so that we can continue to bolster our multidimensional strategy in getting shots in arms. Our vaccine has been really focused, as you well know. Seniors first has been our policy. And we're proud that we have vaccinated close to 1 million seniors, more than any other state in the country. But we are, again, we're really struggling with being able to get increase from the federal government. So our hope is that we will see that allotment increase week over week. That way we can continue to work with our partners throughout the state and each and every county to get as much vaccine out into the communities so that our seniors, which are priority, can get the vaccine and then move on to other groups.
So right now, Lieutenant Governor, the state gets the supply from the federal supply, and then the state is in charge of the distribution. And we've seen the state try to open more distribution points, now grocery stores and houses of worship, also supplementing the hospitals and the counties. But with the new change of administration this week, President Biden seems to indicate that he wants more of a centralized federal process. Do you have any indication that this whole distribution network is going to change in the next week, 2 weeks, month?
Well, we hope not, because we really think that Florida has gotten it right, and Governor DeSantis has commented on this, and he's indicated that while the federal government under the new president has indicated they're looking at doing sort of a FEMA-supported site, we feel that our method is working. We feel it's getting out to the community. We don't need additional sites. We're working with all of our partners, and you mentioned, obviously, Publix. We have over 240 locations in 18 different counties. We have partnerships with hospitals, as you well know, here at Jackson. They have 3 sites set up, working with the county mayors. And we've also rolled out to houses of worship, working with particular communities that may have underserved populations, people with access challenges. We've seen synagogues and other churches where none of their congregants have been able to receive vaccine. That's working really well, identifying pockets of communities. And so we don't really need the federal government to come in and set up sites. We have plenty of those, Hard Rock, Marlins Park, you name it, throughout the state. What we need is more supply, more vaccine. Florida will take care of delivering it to the right locations, making sure our partners are working efficiently, diligently, and getting as much vaccine administered, again, to our priority group, which is seniors first, and then being able to move on to other groups.
Lieutenant Governor, as you well know, 1.3 million Floridians have received their shots. I'm happy to say I'm one of them. Grateful for Jackson for doing that. Got number 1. However, the Democrats say there still are about 1 million doses sitting in refrigerators, freezers that have not been administered. Is that a correct number?
That's just simply not true. We are working, as I said, as efficiently and diligently. The governor has been adamant at making sure that there is no delays. He wants to make sure that those vaccines are being administered as quickly as possible. I mean, I have visited several sites. I've been to Jackson, I've been to Memorial Healthcare, I've been to several Publixes, and I think that we are doing a great job of getting them out into the community as quickly as possible. There is no massive warehouses. The governor made that very clear. We don't hoard afford vaccine. We are doing the best we can with this limited supply. It is really, truly a supply issue. Anyone you talk to, any state really is having the same challenges, and Florida is far outpacing our fellow states in terms of administering vaccine to elderly, and we are number 3 behind California and Texas, obviously, in terms of overall vaccine administered. But again, our request, our cry for help is that the federal government will increase our supply. We will be able to get that out into the community, put shots in arms as quickly as possible. And we're also focused, as you well know, Michael and Glenna, on the nursing home population, the ALFs. Yeah. About 96% of our nursing homes have reported that they have had residents and staff that have been vaccinated, and we're approaching 50% of our assisted living facilities. So again, multi-pronged strategy focused on our senior population, which we know is the most at risk.
Can I ask you something about the long-term care facilities? The state, a month ago or so, stepped in first. When it first got supply, went into a couple of nursing homes, but nursing homes and long-term care are supposed to be under the purview of a federal contract under companies, CVS and Walgreens run companies. They were not there. That was nowhere. And Lieutenant Governor, I know the state stepped in again and went into some of the nursing homes where the federal contracted process was supposed to work. What happened there? Where are those CVS and Walgreens? They're in some places, but certainly not fast and effective. And the state had to once again step in to sort of commandeer that. What happened with that?
Well, I think that really highlights the point that the state is best equipped in partnering with local providers to administer that vaccine as quickly as possible. The governor simply wasn't happy with the pace of Walgreens and CVS reaching out into the nursing homes. We understood the urgency. There truly is urgency around that population, and they are most at risk. Our seniors obviously are vulnerable, but even much more so those that are in that type of setting. So the governor obviously stepped in. We have obviously worked with other providers to help with the assisted living facilities. And again, we wanted to make sure that these shots were being administered as quickly as possible. But I think that really highlights the importance of the previous question about having the federal government come in and set up sites. We certainly wanted to make sure that we were in control of that, and Governor DeSantis has done just an extraordinary job of insisting on efficiency and insisting on making sure that those shots are getting administered as quickly as possible.
Yeah. Lieutenant Governor, let me kind of ask you to dig down into the rollout of the vaccines. It began, I believe, December 17th was about when the first vaccines arrived and were rolled out. The governor and your strategy was to give it to the big hospitals, 5 big hospitals in the state, and then smaller hospitals, and say, you guys figure out how to do it. But the hospitals overbooked. They gave some shots to big board members and donors, and apparently angered the governor, maybe angered you. And now the emphasis seems to have shifted to the State Department of Health. Is that the agency now that is really running this?
So the State Department of Health is coordinating very closely with our Division of Emergency Management. So together from a logistics standpoint and then from a public health standpoint, those two agencies are spearheading this endeavor. As you mentioned, obviously the Pfizer 5, those first 5 hospitals that received the Pfizer vaccine, Jackson, Memorial, Tampa General, Advent in Orlando, and Shands in Jacksonville, those were the first hospitals to receive the Pfizer vaccine because, as we know, the Pfizer vaccine requires some storage, ultra cold storage that other hospitals perhaps didn't want to get into. So then those other hospitals, the remaining hospitals, received the Moderna vaccine. And so every hospital at this point has had access to vaccine. What we have seen, as I think you mentioned earlier, was some hospitals have had to cancel. Unfortunately, some hospitals booked way out into the future. And again, without being able to predict week over week what type of allocation we're going to get, it's hard to book an appointment in mid-February and assume that we'll have vaccine. That's our hope. We continue to press to ask for more vaccine. But I think some hospitals, for example, Jackson has done a good job of sort of limiting the appointments to the actual vaccine on hand so as to not create frustration down the road. Of course, it creates frustration from seniors that aren't able to get an appointment when they open up their system. But we are working as diligently as possible. We've had to tweak. As you can imagine, this is the largest response effort forever in the history of our state. We are accustomed to dealing with hurricanes. We do a good job in dealing with those types of emergencies. This is something that we've never dealt with in our history. So we wanted to make sure that we're tweaking, and that's why you've seen the governor expand his strategy, focus on being able to deliver vaccine to Publix, for example. They have access, easy access within 1.5 miles of a particular county. Any resident has easy access to Publix. Working with those churches, houses of worship, really important strategy. And so we're going to continue to push. But yes, we've had to tweak, and we've had to address issues. The vaccine tourism, I'm sure, is one that you'll want to talk about. And that's
we do, but we gotta take a quick break. We'll talk about vaccine tourism and also some of the concerns we're hearing in the newsroom from people trying to get those appointments. But sit tight, we'll be back in 2 minutes. We are back with Florida's Lieutenant Governor, Jeanette Nunez, on all things COVID and the logistics of the vaccine. Lieutenant Governor, we hear every day in this newsroom from people who just can't get the appointment to get the vaccine. The way it stands now, there's a patchwork of distribution sites, for better or worse, as we were talking about, and it's a lot of the appointment scheduling is online. The very seniors who are eligible are probably the demographic that are least computer literate. And it's almost like a first come, first serve. And a lot of people who can't be first are not getting that. What is the state doing to address sort of these inequities and even trying to get an appointment to get the vaccine?
Yeah, absolutely. And of course, that's a source of frustration for the governor. And, we're not going to continue to harp on the supply issue. I think that's been well documented. I think Floridians and Americans throughout the country understand it is a supply issue. But nonetheless, we have a responsibility to address some of those unique circumstances. And that is one, as you pointed out, individuals, especially those that are elderly, are usually the less tech savvy or have very little access, if any, to technology to be able to go online the minute a system opens and book an appointment. So again, we have been really looking at what are the best ways to handle that. And I think clearly the strategy that the governor has implemented with working with synagogues and houses of worship, I think that's something that we're really proud of, because we've seen in many circumstances, those are the individuals that truly don't have access to technology. And so those churches, they have been very helpful in identifying seniors that don't have access, that don't have technology, that can't go online, and being able to prioritize and identify those that within their congregations, within their mosques, within their synagogues have been identified as individuals that need the vaccine, that meet the criteria. So that's one of the strategies. We're going to continue to work with our counties, again, government closest to the people. They understand the challenges of individuals in that age group not being able to access technology. So we're going to continue to push forward. We're going to continue to work in identifying ways to make it easier for those seniors. But again,
if I may, there's another area where I know it's a big problem for cities, counties, and the state, and that is this growing disparity between people who are white and wealthy who are being vaccinated at a high rate. Like the Miami Herald reports this morning, 40% of the residents on Fisher Island, one of the wealthiest places in the country, 40% are vaccinated there versus 1.4% of the people in Opelika, poor, predominantly black. How is the state trying to change that disparity?
Yeah, absolutely. And that's something that we look at. We pour through the data and make sure that we're identifying those pockets of community. So working with our county mayor, working with those elected in that area, we are asking them, please help us identify an area where we can go into, a church in the middle of your city, in the middle of your community, so that we can provide ease of access, that we can provide vaccine to those individuals that don't have the type of access as the figures that you're pointing out, Michael. So really that strategy strategy has been working. We're going to continue to employ that strategy and see how we can further delve into that potential disparity. And we want to make sure in certain communities, there's always vaccine hesitancy in certain communities. And so we want to make sure the more they see individuals getting vaccinated, the more people feel comfortable. And that's true even within our healthcare worker community. You know, I asked a hospital recently, what was, you know, when you pre-surveyed before you received the vaccine, even within the healthcare workers, they had said they had about a 50% response rate of individuals that work there that would have liked to have received the vaccine. Well, that is growing because of the confidence people are having, seeing their peers getting vaccinated, seeing that there has been little to no effects. Right. And so that we hope is going to continue to grow. We hope pockets of communities that maybe initially were a little hesitant to receive the vaccine are going to see their peers being vaccinated, and so that will continue to grow. Again, supply is going to...
We've seen and heard and documented the very same thing, and while we're looking at the supply as the major issue, you brought up something like vaccine tourism, which kind of fits into the overarching concerns that people have of fairness. That is what we hear the most here in the newsroom. We've documented cases of what you call vaccine tourism, people coming from outside the country specifically just to land in Florida, get the vaccines, go home. Is that a one-off? Is that a huge problem? Characterize, put that in context for us.
Sure. Well, imagine if you receive calls every day, I promise you I receive the same calls. And so that's, again, we're always trying to address issues that pop up, things that perhaps we did not anticipate. Florida is in a unique position. We know we have an inordinate amount of snowbirds, probably more than any other state in the country. And so that obviously is going to be a little bit of a challenge. But what we've done just last week, the state surgeon general issued a public health advisory indicating that those that are administering the vaccine, they need to ensure that it is a Florida resident. So no individuals coming into our state from another country or another state saying they're here for whatever reason and then going and taking a spot that should be held for a Florida resident. And so that's something that I think really addresses part of the issue. And so the providers that are in the game, right, giving vaccine, they're going to require a Florida driver's license. They're going to require some sort of documentation, whether it is a lease or a utility bill, something that'll prove that you reside here in Florida.
Can I just ask a quick follow-up in the short time we have? Is that going to be problematic for countless people in South Florida who are undocumented yet live here? Will they be able to get that kind of vaccine?
Well, obviously, we're going to have to continue to address challenges as they arise, but we want to make sure that Florida residents, especially our senior population, you know, we hear, like you, every day, countless seniors can't get an appointment, and then they see other individuals that are from another state, another country, perhaps here illegally, getting vaccine, and I don't think that's fair. And so we want to make sure that we're doing everything we can to avoid vaccine tourism. When we look at the data, it shows that 97% of vaccine is going to Florida residents. That remaining 3% is, like you asked, is it a one-off? Is it a big problem? I would say that any individual getting a vaccine that's not a Florida resident is a problem. But within that 3%, we also have to keep in mind that you have healthcare workers that are coming from other states here in Florida to assist with vaccine, with COVID. And so we want to make sure those individuals are vaccinated too. So those healthcare workers will fall within that 3%. So it's hard to say exactly how many instances of people that fly into our state just for the purpose of that.
We're glad, Lieutenant Governor, we're glad to know you and the state are on that case because, as Glenda says, we hear those complaints daily in our newsroom. Lieutenant Governor Jeanette Nunez, always a pleasure to speak with you. Thanks for taking the time.
Thanks so much.
Thank you both.